This original WSRE presentation is made possible by viewers like you. Thank you.
Her passion for the healthcare industry began as a volunteer. Now she's the Chief Executive Officer of a major healthcare corporation. Laura Kaiser on this edition of Conversations. I'm Jeff Weeks. Thank you so very much for spending some time with us on this edition of Conversations. We welcome Laura Kaiser. She is the new President and Chief Executive Officer of the Sacred Heart Health System. Welcome, Laura.
Thank you very much.
Give me a little bit of background. I know you were a teenage volunteer. I think you were a candy striper, right? That's how you first got interested in the healthcare business? Tell me the story.
Well, I was a teenager, junior high, and my parents probably thought I had too much time on my hands, and they wanted me to find a volunteer opportunity and suggested that I go to the local hospital, and they told me about something called candy striping. So I did that for a couple of years, which entailed being on some of the nursing floors and feeding the patients, passing water and so on, picking up supplies, and I loved it. And so went from there.
Where did the candy stripe, in case folks don't know, where did that come from? What does that mean?
You know, I actually don't know, other than I wore a red and white outfit that looked a little bit like a candy cane. But I don't actually know the history. I'm sure there is one because candy striping and teenage volunteering is typically called candy striping throughout the country, but I don't actually know the story.
Interesting. So you get in that environment. What was it about that environment that appealed to you?
I think it was that there was so much going on, and I'm someone that always likes to have multiple balls in the air, and I was curious about the healthcare aspects of it and being around people and the opportunity to help others because I'm pretty service-minded.
Why take the track on the administrative side of things as opposed to, did you ever think about being a doctor or nurse? Or?
Well, I took anatomy when I was in 9th grade, and that was also right during my time of being a candy striper, and I thought that was absolutely fascinating in biology and so on. So I did think about a clinical career, thought of medical technology actually. And we have some healthcare professionals in my family, so that seemed like a natural course and a direction to go. So when I went to college, I was thinking that I would do something along those lines. And then I encountered some of the science courses like physics and so on, and thought, probably not my best direction. And so I went in a different direction, and my gifts lie more on the administrative side.
What is it about the administrative side that appeals to you? Because it seems to me in a hospital type environment, you're managing an awful lot of different personalities. So it must be a real challenge, but at the same time, pretty rewarding.
Oh, it's wonderfully rewarding. I think it does harken back to what I said a minute ago in terms of having multiple balls in the air. There is no one day that is the same. I'm working with talented, bright individuals, scientists, different healthcare professionals, different business people, people in the community. Just having all of that variety is endlessly fascinating to me and very rewarding because I'm always learning something new, and it's an opportunity to help serve others and make a difference. So that all of those ingredients suit me. And it resonates deeply with who I am, so it makes it easy.
What are the challenges, though? Because, I mean, you're right, you're dealing with administrative folks, you're dealing with marketing people, you're dealing with physicians, you're dealing with nurses. What are some of the challenges? Because I guess you almost have to be constantly shifting gears, I would think.
Absolutely. A couple of challenges just off the top of my head that come to mind is there are many competing priorities, and so how does one manage their time as well as possible to have the most impact, and helping all of that variety and diversity of opinion and all of that collective intelligence to help people reach consensus and push the cart in the same direction together. That's not always easy, and so it's challenging. It's also really rewarding when it does in fact happen.
What would you say is the number one trait someone has to have in order to be able to mesh that together?
You have to be a great listener. You really have to listen to, for me, from my perspective, because you have all of that diversity of opinion, diversity of background, and so on, there are many, many different perspectives. And there's typically more than one solution. And so I have some ideas of my own, but there are many other ideas. And so I think you really need to be able to listen well to what people are saying as well as what they aren't saying, and sift through all of that to then arrive at the best decision for the community, for the issue at hand, and go from there. But you have to really listen well, because sometimes some of the most important things that emerge are not initially said. They're deep inside, or they're just, people are a little reluctant to share some of those best ideas for a variety of reasons. So you have to work at that and draw it out over time.
How do you bring it out? How do you bring folks out?
Well, I think from my experience, if I think about even friends that I have some friends that are very gregarious, I have other friends that are more thoughtful, more introspective. I think it is about the listening and creating a safe environment from which people can feel free to express themselves. We call brainstorming blue sky, and so in brainstorming there are no bad ideas. There may be some bad ideas,
right.
But when you're brainstorming, you're not allowed to pot shot, and so you're just trying to get as many new ideas out as possible. And so I think it's mostly about creating a place where people are feeling free to just be creative, and the good ideas come from there.
You hear so many people oftentimes say, well, I had a wonderful idea, or so-and-so had a wonderful idea, but they were afraid to bring it out because maybe they would be rejected. What would you say to those type of folks, and also to other managers? What advice would you give them to cultivate that, to bring those ideas out?
I'd go about it in a couple of different ways. Some people, depending on their personalities, as I mentioned, some people are very gregarious and love group settings, and they love to feed off the energy of others. Others need some space in which they can do their best thinking quietly before they're ready to share those ideas. And as a leader, I think it's incumbent on you to get a sense of different people's personalities, their different talents and strengths, and where their best ideas will emerge from. What's the setting? What are the conditions? And so that if you know you have someone who's quieter, who needs some space to think, find some time to sit with them one-on-one, and to reinforce some of that good thinking, or to elicit some of that thinking. And you can take it to the group, or you can ask that person to take it to the group, so that they may have needed a little time to vet those ideas before they go into that group space. So just a couple of ideas.
I've asked this question to a lot of business leaders. Is there a difference between a leader and a manager?
I think so. And I thought of that years ago as well, because I'd heard that same distinction, and I was curious about that, because you can define management and leadership in similar ways. But I think for me the biggest distinction is a leader is someone who will think about any given responsibility or problem, any challenge, and think about what is it that I as a leader can do to help inspire and motivate that change and influence and lead. And a manager needs to do all those things as well, but managing is also about ensuring that we are getting from point A to B, and it may be more tactical. So I think a leader, it also requires a fair amount of strategic thinking and strategic influence as well. So there's overlap, but if I need to discern between the two, that's what I'd say.
As you look for leadership in your management team, do you look for somebody who is extremely strong on the hard skills, the technical skills, or would you rather find somebody who's better on the soft skills, the people skills? I mean, I guess ideally you want both, but I guess the question I'm trying to say is what's more important in the end game?
It absolutely depends on the situation and on the task at hand. The right answer is to have all of the above. And so it depends. I like to think of having in my team a group of individuals that fill in each other's gaps, because we all bring different talents and gifts. And I've heard many leaders say that they'd like to be surrounded by people smarter than themselves. I could not agree more. And so it really does depend on the existing team's deficits or strengths versus weaknesses and so on, and then just to fill it in.
You know, interesting you say that. I know a lot of folks say, I want to be surrounded by people who are smarter than me, but in so many cases, they just don't act upon that. Why do you think they have that insecurity? Why do you think people, because ultimately, I guess, if you're surrounded, and the team wins, you're going to look good.
You'd have to ask them. I'm not sure, because for me, the stronger a team, the more the boats are lifted in total.
Right,
and so I think it's really important to find all those different skills and abilities. And so I'm not sure, because at least in my experience, it's been far better to have people that are as talented as I can possibly find, and for us all to work together.
Take me back as you go to college, get your degree, get out, enter into the healthcare field. Take me kind of through your resume here.
Okay. So I grew up in St. Louis, and when I was trying to decide what to do in college, I ended up at the University of Missouri, and I was originally thinking that I would do something clinical. And I floated around a little bit and tried on a couple of different majors, and I was on a very clear 4-year path. My parents, I was very blessed, and was given the opportunity to go to school for 4 years. My parents sent me. I had 4 years to do that. Some people have 6 years to do that. I had 4 years, and then I was on my own. So it was very clear that I was going to get my degree in 4 years, which was great. And so in my beginning of my junior year, I had not declared yet. And I went to the Career Planning and Placement Center, had already ascertained that I wasn't going to go the clinical route, and did some testing. And I came upon a little brochure that was about health services management. And I'd really never heard of that before. I had thought all about the medical field, the healthcare field, and I mentioned it to my parents. And my father is who told me about hospital administration and said, "Oh, I think that requires a master's degree, but you should look into it." And I told him I had found this brochure. So I went to the Dictionary of Occupational Titles, which was about 2 reams of paper thick, and looked through many different fields, including hospital administration. And as I read it, it grabbed me. And so went on to graduate school, got an MBA, MHA, and from there I wanted to get some additional real-world experience and did healthcare consulting for a while, was a hospital administrator, did physician practice management, picked up a long-term care license along the way because I had done pet therapy, taken dogs and cats to a local nursing home, and then joined what is now Ascension Health. And so I've had a very eclectic, diverse healthcare path, for which I'm grateful, because I think it's helped me to gain additional diversity of perspectives over the years.
I get asked this question a lot when I talk to folks who see us interview various business people, but I guess is the key is, if you're a young person getting out of school, what's the key to get on the, I hate to use the word fast track, but to get to where you are, to run the whole show, to be the CEO? What should you be doing?
My first recommendation would be find your passion. Find what you love to do, because there's a reason it's called work. But my gosh, how much more rewarding and thrilling and good you will be at something that you actually care about and that you love. So that's my first piece of advice. And when you've found that, you have to get really quiet to figure that out. Some people know, and I'm always surprised when I learn that someone knew what they wanted to be when they were 3, because I didn't. I had all these different diverse interests. So get really quiet and figure that out, and then pursue it. And it's age-old advice. Work very hard, get as many experiences as you possibly can, and sit at the feet of people who you admire, within and external to your field, because you can pick up a lot of what to do and what not to do as well, and try those different things on in terms of what works for you, because at the end of the day, you have to be yourself. And I think that it's pretty easy to forget that and think about what different personas should I try on. You have to be yourself, because that's authentic and that will come through. And I would look also for mentors along the way, because I've had many, many people that have looked after me, and I'm better for it, and I've learned a lot from them, and they've helped me in my career as I've networked and met different people and have skinned my knees and things along the way. So I'd look for for mentors, advisors, trusted friends and advisors that could help you test yourself in terms of what am I good at, what do I need to be working on, and seek those out actively. So it's really, I don't think there's any magical formula. It's about doing all of the things I've said are a combination of, but mostly just getting really quiet and listening to yourself in terms of what is it that I want to do, how hard I'm going to work at it, because you need to work hard, and then really surrounding yourself with people who care about you and will help you find your way.
You know, what's amazing is I think almost all successful people will tell you to find your passion. And I think we all kind of know that, but for some reason, so few of us really do that.
And I think that's a big tragedy.
Yeah.
I really do. I hope I will be in healthcare for the balance of my days in my chosen profession. When I retire, I can't imagine sitting still. I'll do something differently. But I'm already surprised by how quickly it's going, and it's because I love it.
Yeah. Women seem to be making, and you tell me if you think this is the case, certainly some cracks in the glass ceiling, if not breaking the glass ceiling. I look at Yahoo, the chief executive officer is a woman. Pepsi, CEO is a woman. Here in this area, Susan Storia, Gulf Power, you with Sacred Heart. Your thoughts?
I think it's great. So, and you know, I think it's interesting. I've never really thought about it that way. There have been so many women who have come before me, and so many talented women in my field and in other fields, and I applaud them and other leaders. I'm not focusing so on gender. I think that women have extraordinary gifts, and I've heard from many that we are able to multitask well. And I have lots of friends and that I can absolutely point to and say, that's certainly true. But I also have an equal number of male friends that are also good multitaskers. So I think it's more about just an evolution of time. And I'm glad to see it happening because I think it's that we are all different, and so collectively we're going that much further. So I don't have any big theories about it other than what I've just said.
So can I put you on the spot and ask you, I asked Susan Story this, do women make better managers than men?
You know, I don't know. I bet it depends on the field. Yeah. Because there are so many different requirements of leaders, so many different facets of one's personality and style that depending on the field, there are probably some fields that women are better managers and leaders, but there are others that men are better. It just depends. And I think it mostly depends on the individual.
Let's shift gears over to the world of healthcare. And obviously there's been an awful lot of talk about healthcare reform. In your opinion, is the reform needed?
Absolutely. We absolutely need to do something with healthcare, and for a variety of reasons, not the least of which is that we do not have equal access to healthcare in this country. And there are 45 plus million people that are without adequate access to healthcare right now. They're either uninsured or they're underinsured. So there's something wrong with that. And so we need to address it in some way. There is a need for reform. I don't have a magical answer about here's exactly what we need to do, but I'm actually inspired by the conversation that's been underway over the past several months. And we need to improve the access. We also need to realize that it isn't something that we can continue from affordability as a country. It is consuming such a significant part of our gross national product, and it's only continuing over time. It is not sustainable, and so we need to think about it differently.
The conversation is a political hot potato, obviously, and do you think it's too much of a political hot potato, and maybe the two sides aren't coming together and sitting down and talking rationally? Would that be a fair assessment? That it's too much of political agenda, maybe?
I actually think there was some really excellent conversation, excellent discourse in the early days of the healthcare reform, and I was quite encouraged. I think that it ended up devolving into more of a political hot potato, unfortunately, and I'm hopeful that there will be some more partisan efforts to really talk about this in a constructive way.
Do you think perhaps the American public just doesn't realize the problems that exist, and so maybe their appetite is not as great for reform as maybe it should be?
It's part of it. Healthcare is a complicated field, and the way in which much of healthcare is paid for cloaks the actual cost of healthcare by way of health insurance, and the way that there is billing and how that all works with a partial copay for the individual and all those things. It's a lot. I've just thrown a lot of acronyms out there and descriptors that are unique to healthcare, but it makes it confusing. Unlike if you go into a store, you see something you want to purchase, you pay for it, that's the price tag, and you walk out. There are a lot of things that don't show that within healthcare as clearly. So I do think that it is partially cloaked.
Tell me about how you handle people who are uninsured, and how does that cost affect someone who is insured?
Well, at Sacred Heart, we last year spent $58 million on care that was for people who were unable to pay. And we had budgeted $30 million. So in this economy, there are more people that are uninsured. And so even though we care for anyone that walks through our doors, we had anticipated that that would be a $30 million number. It was almost 60. So pretty dramatic. So that affects all of us, because as a healthcare enterprise whose mission is to care for everyone, that isn't something that's sustainable for us over the long term. So that is paid for by all of the people that come to the organization for the care, and at some point in time there will be a finite point, and it's not something that I enjoy thinking about or intend to do tomorrow or in the foreseeable future, but at some point it's what I was meaning before in terms of this is not a sustainable business model, not just for Sacred Heart but for the country.
Do you think that as far as coming up with a solution, we would be better to establish some sort of, use this word loosely, but committee or something of healthcare professionals to come up with a plan and then present it to the politicians, as opposed to politicians trying to come up with it?
Well, I think some of that work has been underway, and I've actually had a number of different conversations with some of our local elected officials, and I think there really is an interest in becoming more informed about what healthcare is. It's difficult to have that conversation because it's so complicated. And so I think it's actually a mixture. I think it's a mixture of healthcare professionals, because sometimes we can get too insular in our own views. And so I think it would be most healthy to have a combination of citizens, patients, community members, just really a diverse set of folks for a focus group or for continued conversations, which includes elected officials as well, because this is something that's affecting every one of us, and there are many perspectives that need to be taken into consideration.
It has to be a real team effort.
It does.
Yeah. Sacred Heart is really growing. I know recently you opened the new cancer center. Tell me about that.
We're so excited. The new cancer center just had its blessing and dedication last week, and we are predominantly moved into it. There will be a community open house in the near future, and it's absolutely beautiful. We have provided cancer care for many years at Sacred Heart, and we do have a number of different locations. This new cancer center is replacing our cancer center that is on our Pensacola campus, and it's been bursting at the seams. And this isn't true, but it seemed that way by contrast, that we were getting so busy and so crowded that I could envision bunk beds, in the space. And it's not an inpatient setting, but this is our outpatient cancer facility, and it is absolutely what our patients deserve, and it is full service for all different types of cancer treatment and radiation therapy, as well as chemotherapy, medical oncology. And so it is a jewel for the community. We're really very excited that it's up and running.
The Sacred Heart organization throughout Northwest Florida, what all does that encompass?
We are regional, and we have a number of hospitals here in Pensacola, as well as the Emerald Coast facility, which is a 58-bed facility over in the Destin area. And we're about to open our newest hospital, which is a 25-bed facility in Port St. Joe, Sacred Heart Hospital in the Gulf. We also have a number of ambulatory care locations in Baldwin County, Alabama, and in Pace, and a whole host of physician offices all over the area. And we also have the Haven long-term care facility, which is near the Pensacola airport, and a variety of other ambulatory settings, ambulatory surgery centers, radiology, and so on. So a lot of different locations and sites.
Now, you just recently became the Chief Executive Officer of Sacred Heart, and what are your goals moving forward here?
Well, this is really an amazing opportunity for me, and I feel very blessed to be entrusted with this ministry. This ministry has been here for many, many, many years and has been led by so many capable leaders that I feel like I'm here to help build on the success that already has been in place for this community. So it's not about a big shift in strategy. It's about continuing to focus on what our community needs and to deliver that. So the Cancer Center is our latest example of a community need and working at delivering it and doing that well. So we have other things that we are focusing on going forward, but we're taking some time now to figure that out, and we'll just continue to hopefully be vital, important healthcare in this community.
Get a little short on time here, but can Northwest Florida really, I mean, could healthcare be the industry in Northwest Florida?
No, I don't think so. I think that healthcare is a facet of a community, and it certainly is one of the key industries in this community, but I think that any healthy community has a variety of economic engines, and it is a service industry, and there is a need for any community to have a variety of different things that are generating a vibrant economy. So it is absolutely an essential part, but it is not the only part.
I always like to ask successful people this as we close out the program. Very challenging times right now for both people getting out of college and people even in mid-career looking to change. You've obviously been very successful in your career. 2 or 3 bullet points. What do people need to keep in mind right now in this challenging economy?
Be flexible. Be open-minded. And continue to network.
Good advice. Laura Kaiser, thank you so very much for joining us.
Thank you for having me.
It was a real pleasure talking to you. Laura Kaiser, she is the new President and Chief Executive Officer of the Sacred Heart Health System. I'm Jeff Weeks. We thank you so very much for watching this edition of Conversations. Take very good care of yourself, and we'll see you soon.